Okay, Dina? We can do it? Terrific. Good afternoon. Good afternoon. I feel like I'm preaching to the choir with this lecture. I like to think of them more as discussions than lectures. And I want to talk to you a little bit about the disease concept of addiction. And even that is kind of a misnomer. I think people are misled when we talk about the disease concept or it fits the disease model. This is a disease, a disease, a disease. And I'm going to try to prove it to you with some evidence. We have a lot of vested interest in swallowing this whole, that is, the disease of addiction. Primarily because physicians are great offenders, as are people in the treatment field, of forgetting this concept over and over again. We do it all the time. If you have a patient who goes out and relapses, oftentimes we get shocked or embarrassed for them. If you're the drunk who shows up in the emergency room, he's oftentimes treated as a pariah and parked in the corner till he sleeps it off while I treat the sick patients. You know, I've seen that in the medical field for years. So we don't always behave like we really believe in the concept of the disease. So let's talk about the disease of addiction and why we have a vested interest in really believing this. First, let's start with the definition of a disease. And again, forgive me if this is very elementary for my educated audience, but disease is a loss of function of an organ or an organ system, its parts, producing a set of symptoms with a known or unknown cause. And we're going to use alcoholism and addiction together. We'll call it addiction. Is this a disease? Or, as many people behave, is it a choice? Well, let's take a look at the difference. Let's say I have a choice. I'm going to ask Andrea here to be my little brother Tom for a minute. You know, I had two brothers, Tom and Dick. That's the truth. And Harry. Yeah. So let's just say you're my little brother Tom. We got to lighten this up. This late in the afternoon. Yeah. Okay. So I have a choice now. See, I'm going to go and beat up my little brother. And I'm going to do that. And he gets hurt. And I'm responsible for this. It's really my fault. I've hurt him. And what I've just exhibited is bad behavior. And my mother is quite convinced that some punishment's going to work. And indeed it does. If it's exerted in the right way, it works and my behavior stops. Now I can't tell you exactly what the cause is of my behavior, but maybe I saw my father use his hands, or he's used them on me, or maybe there's been some financial stressors in the family and I'm angry because the kid down the street has a new bicycle and I don't. I take it out on my little brother. Or health issues, you know, maybe I'm just a hyperactive kid that is misbehaving and whatever. But, you know, I have some free will here and I can stop that behavior. I can stop it. With the right amount of pressure exerted, I can stop it. Let's take a look at a disease. We're not responsible for contracting or inheriting a disease. It's faultless. Are you responsible that you were born a female? Or, Bob, are you responsible that you were born a male? Or your height? Or your eye color? Is that your fault? Is there a responsibility there? No, it's inherited. So it's faultless. What we do to exhibit the behaviors of a disease, what we do when we have a disease, what symptoms we have, are called symptoms. They're not behaviors. We know that punishment doesn't work. If you look at our penal system, and 80% of those people who are incarcerated have a substance use disorder, well, you know full well punishment never works. If they go untreated, they get released, they get stressed, they look for